Welcome everyone to the Mobility and Bathing Assistance Plan's presentation for unregulated care providers, including community health workers and adult day service workers. My name is Sandra Helena, and I'm the Regional Knowledge Coordinator for Home Support Transformation. Before we begin, I just want to recognize and acknowledge that we are collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior Region First Nations, where we live, learn, collaborate, and work together. This region is also home to 15 chartered Métis communities, and it is with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit people across the interior. So at the end of today's session, you should be able to explain the purpose of the documents that we're going to talk about today, describe the changes that have been made to them, and of course be able to read and understand the new versions in order to provide safe and effective care to clients. Now first off, I just want to give some background regarding the changes that are being made. So one of the goals of Home Support Transformation is to transition forms from paper format to electronic versions so that both clinicians and unregulated care providers, like our community health workers and adult day service workers, have easier access to the required information. So as a result of this goal, the current forms needed to be updated to provide more clarity to the clinician and the UCPs, and of course the forms needed to be better structured for use in the electronic medical record. I think everyone can agree that this is a much needed transformation. So the updated documents were developed by the Mobility and Bathing Assistance Plan Working Group, and it was comprised of some occupational therapists, home support team leaders, care managers, a workplace health and safety advisor, and IMIT staff from across Interior Health. We also obtained feedback throughout the process from our community healthcare workers. So the documents are designed to have better flow, clear information about the client's abilities, and any equipment that they need to help keep you safe and to continue to provide safe care to your clients. Okay, so what's the purpose of the documents? The purpose has not changed. It is, of course, to communicate to unregulated care providers the client's level of assistance and their abilities in relation to their mobility and bathing so that care can be provided safely. So in addition to that, there are some other things that remain the same. First off, the forms still meet WorkSafe BC regulations for injury prevention. They remain a tool that communicates the client's abilities to unregulated care providers. A paper copy will still be in the home binder and at adult day services, but it's going to look a little bit different. These documents are also a snapshot in time of the client's abilities on their worst day. And of course, unregulated care providers need to communicate to most responsible clinicians if the client's abilities do not match what they see listed on the form. That practice remains the same. So let's take a look at the new forms. Now I'm first going to show you a copy of what the Downtime looks like. You can see it here on the slide. It looks entirely different from the current plans that are in the home binder, and clinicians may have to use this if the Meditech system is offline. However, this should be rare. The majority of the time you will see the document as it is printed from the Meditech system. So let's take a look at that on the next slide. Okay, so this is what the form will look like when it is now printed out of the Meditech system, and this is what you will see in the home. So you can see at the top is the title of the document, the Client Mobility and Assistance Plan. You will have the level of assistance that the client is. So currently, for this example, it is minimal assistance. You will have a list of the client's observed activities. So the questions that the clinician asks are on the left, and the answers, of course, are on the right. There will also be if any equipment required, a list of that equipment here, any comments about that equipment, and finally, there's a notes section at the bottom where the clinicians would add any additional information that you need to know. Okay. This is a copy of the bathing assistance plan, or the downtime form for the bathing assistance plan. It looks very similar, as you will see, to the mobility assistance plan. Clinicians may have to use this if the Meditech system is offline. However, this should be rare. The majority of the time, you will see the document as it is printed from the Meditech system. So let's take a look at that on the next slide. So once again, you can see the title of the document at the top, the Bathing Assistance Plan. You will also now see a location and description of the bath shower. So where is it to be taking place? So in this example, it's in the main bathroom in the client's home, and it's going to be taking place in a bathtub. Then, of course, you also have the observed client abilities, so those questions and the answers next to them on the right-hand side. The client's level of assistance, so in this example, it's mechanical assistance. The equipment that you're going to need to provide that care to the client on the right-hand side, comments about that equipment, as well as notes section. So there may or may not be information in that section. Now, you're probably used to viewing the mobility and bathing and equipment needs of the client on the service plan, like you can see on the left-hand side. And you would either see that, of course, currently either on the paper form or on your mobile device. So I just want everyone to know that as of our go live date of April the 6th, you will still see on the service plan the title of those sections, such as client mobility, mobility equipment, client bathing, bathing assist equipment, but there will no longer be any information in those sections. Okay? You must locate all of the client's mobility, bathing, and equipment needs on the new mobility and bathing assistance form, which you can see on the right-hand side in the equipment section there. Okay, the other thing I wanted to mention is I just want us to take a closer look at the levels of assistance. So you may have noticed that one of the biggest changes is that there used to be 6 levels of assistance, and now there are only 4. So the first one is independent, and that's where clients can mobilize and transfer themselves, and they don't need any queuing or physical assistance to do that. The next one is supervision. The client can mobilize and transfer, but they're going to need some queuing to do that, and they can sit or stand without any physical assistance. Minimal assistance means that the client is able to mobilize and transfer themselves, but they're going to need some minimal physical assistance, steadying, or support. And of course, just as a note, all of us, including unregulated care providers, cannot push, pull, or lift anything greater than 35 pounds, and that is written into the Safe Patient Handling policy. And finally, if the client is mechanical assistance, it means that the client requires a lift to mobilize and or transfer. Okay, so let's take a look at print. So of course, the forms are now going to be completed electronically by clinicians, and the printed copy will still be in the home binder and an ADS, but it's going to look different. We have 4 levels of assistance rather than 6, as we talked about. You will need to view all equipment needs on the mobility and bathing forms. They will no longer show up on the service plan after the go live date of April the 6th. You should be looking to the notes section on the new printouts as well for any additional information that the clinician has documented there. And of course, you may have noticed that we're using the term UCP, or unregulated care provider, rather than just CHWs, because this applies to more than just our CHWs. CHWs. It also is relevant for our adult day service workers. So the rollout of these documents is going to happen in a phased approach. So in phase 1, which begins April 6th, clinicians will begin to transition all of their clients to electronic document format. But the electronic version needs to be printed and distributed to the home or to ADS. In phase 2, we're hoping that by September, all of the current clients will have an updated electronic version, and that electronic version will be available for our CHWs on their mobile devices. And then we can eliminate the paper copy out of the home. Of course, paper copies will still be utilized in the adult day program. So what are some key messages, or what's important to you? Basically, it's important to understand that the documents provide greater clarity for clinicians and unregulated care providers, that the form in the home or in ADS is going to look different, that it still supports WorkSafe BC regulation for injury prevention, and finally, of course, if you observe that the client's abilities do not match what is written on the form, then please contact the client's most responsible clinician and let them know what you have observed. So some important dates, of course, as I've said, our go live date for this is April the 6th. We do have several education options for our unregulated care providers. There are some facilitated education sessions happening in iLearn, and you can register number 3477. You may be having this education provided at your local site by your team leaders or ADS coordinators. And finally, of course, this is the recorded presentation that you're listening to, and the link for that is located with the team leader or ADS coordinators. And of course, our go live date, we are hoping for a September date for that. So if you have any questions about this in the future, you can contact your team leader, home support, or adult day services coordinator, a local operational knowledge coordinator, a community integrated care coordinator or manager, myself, Sandra Helena, or our practice lead, Suki Balvin. Thank you so much for listening and have a great day.